Hello everyone. This is Otorhinolaryngology mnemonics and tutorials. Last time we uploaded a video on hallmark findings from Cummings' latest edition. The Cummings edition, as you know, is one of the most recognized standard textbook of otorhinolaryngology and head-neck surgery. The video was it got a very good response from all the residents and ENT surgeons. We'd like to thank you for that. And those who haven't checked the video, the link is on the description. And this time we have brought you the hallmark findings from another most popular and widely recognized, in fact, watched textbook of otorhinolaryngology, ENT, and head-neck surgery. That is the Scott Brown 8th edition. So this is the time for the ENT hallmark finding from Scott Brown 8th edition. So we move on. The hallmark number 1 is the clinical hallmark of acute invasive fungal rhinosinusitis is febrile neutropenia and facial pain. So the thing to remember is it is with or without nasal congestion and orbital sign that look most of the rhinological symptoms. So they may or may not be present. So the hallmark is febrile neutropenia, facial pain. So second, the hallmark of thyrotoxic periodic paralysis, TPP, is hypokalaemia. So it is thought to result from the action of thyroid hormone on sodium-potassium ATPase activity. If you recall the physiology, you know that it is the kind of pump that moves out 3 sodium ions and moves in 2 potassium ions. So that leads to a reduced amount of the potassium concentration, leading to hypokalemia. 3. Low serum T4 concentration is the hallmark of reduced thyroid function. So among all the TFT variables, the low serum T4 concentration is the hallmark of reduced thyroid function. 4. The hallmark of allergic fungal rhinosinusitis is the presence of allergic mucin. So it's taken from volume 1, page 1051. Okay, in the previous hallmark findings also we have the volume and page number on the bracket, so that it is easy for you to go back and recall. So we come into hallmark number 5, that is the hallmark of imploding maxillary sinus. Imploding maxillary sinus, they have described a entity that is also called silent sinus syndrome. Okay, the hallmark is that there is a lack of chronic sinusitis symptoms. There is lack of chronic sinusitis symptoms like a nasal discharge, obstruction, facial pain, and so on. Instead, the patients present with enophthalmos, occasionally with double vision. Okay, so it is a kind of condition in which there is a kind of suction effect over the maxillary sinus, and all the walls of the sinus, they go into the state of collapse. So there is decreased height of orbital floor, leading to enophthalmos and double vision. 6. Progressive facial weakness or palsy has always been considered the hallmark of epidermal cysts of petrous apex. Progressive facial weakness or palsy, epidermal cyst. The other name is congenital cholestoma of the petrous apex. The other name for epidermal cyst of petrous apex is congenital cholestoma of petrous apex. And regarding the origin, there are 2 things that are important. One is sequestration. There is sequestration of cell rest. Sequestration of cell rest. And the second important point that we need to remember is Cecil's pocket. Cecil's pocket. Cecil's pocket. Okay, these are explained on the bottom 2 page number 1319 of 8th edition Scott Brown. You can go and check the details on that. 7. Epigenetic regulation contributing to carcinogenesis is considered the emerging hallmark in the cancer development. So this is the emerging hallmark for the cancer development. It could be asked or tested in the recent advanced section as well. The epigenetic regulation that is contributing to carcinogenesis is considered as an emerging hallmark in the development of cancer. So we come into point number 8. The hallmark clinical signs of airway obstruction. Airway obstruction hallmark signs. These include stridor, increased respiratory rate, tachycardia, sweating, and use of accessory muscles of respiration. Point number 9. The hallmark of myasthenic gravis is fatigability. The hallmark of myasthenic gravis is fatigability. 10. So, volume 3, page 484. So, it has mentioned the 8 hallmarks of cancer. And there is a nice flowchart also as well to represent it in the textbook. You can check out it later. So, the 8 hallmarks mentioned are growth factor independence 1. Second, evading growth suppressor. 3. Avoiding apoptosis. 4. Maintaining replicative potential. 5. Angiogenesis. 6. Invasion metastasis. 7. Reprogrammed energy metabolism. And 8. Evading immune destruction. So these are the 8 hallmarks of cancer that is mentioned by the Scott Brown latest 8th edition. So we come to the final one, that is the halitosis and regurgitation. Halitosis and regurgitation, they are unsurprisingly the hallmarks of pharyngeal pulse, okay, which result from the pharyngeal diverticular. So, hope you like the video. So please keep updated on our channel and subscribe to our channel so that we can upload you more videos. We can bring out more information, with the references and the latest resources. So thank you. Take care.